Today, we're going to look at a muscle in the lower back that can be a major contributor to lower back pain. The muscle is called the Quadratus Lumborum, or what's abbreviated QL. I'm here today with Karin Shimoyama and Alicia Gard. Before we show the technique, we should look at the anatomy of the QL. Here's a diagram of the Quadratus Lumborum as viewed from the back. Here's the QL right here where it attaches to the top of the hip and to the sides of the lumbar vertebrae and on to the 12th rib. On the other side of this picture are the erector muscles, which cover a majority of the QL and make it hard to access. So because the QL is hard to access, we're going to show a lesser known technique called muscle energy technique, or what's abbreviated MET. Muscle energy techniques do two main things. One, they stretch the muscle, and two, and more interestingly, they reprogram subconscious patterns, muscle patterns that muscles can get into. So the first technique that we'll show will be with the patient's clothes on and in a sideline position. So go ahead and get onto the table. And I like to make the patient very comfortable, so I'm going to put a pillow between her knees, and then she can rest her arms on the pillow as well. And what also makes it easier for me is if she's on the side of the table, closer to me, which she already is. So with the muscle energy technique, the important thing is to have the target muscle, in this case the QL, contract in an isometric way. An isometric contraction is where the muscle is contracting but not lengthening or shortening. It is in a contraction and in a solid state. So in order to do that, for the QL, what the QL normally does is it moves the hip up towards the top of the body. So in order to get the QL to contract, what I'll do is I'll push in the opposite direction, and I'll tell Karin to not let me move her, so she'll resist that motion, and that will get the QL to contract. So again, the QL is right here and attaches to the top of the hip, and when it contracts, it moves the hip headward. So I'm going to push in the opposite direction, and by saying, Karin, don't let me move you, I'll push, and she's resisting. We're getting an isometric contraction of the QL right in here. Hold for 10 seconds, and then I say relax. She relaxes, and then we get a stretch out of the muscle, along with the neuromuscular reprogramming. So Alicia is now on the table, and we're going to show the other method of doing the same MET that's more common for massage practitioners. If you have already applied lotion or oil to the patient, then their body will be a little slippery, but again, for muscle energy technique, you only need a small amount of pressure. So again, the technique will be that I'll push against her hip, tell her, do not let me move you. We'll hold that for 10 seconds, and then I'll ask her to relax. She'll relax, and we'll get a physical stretch out of the muscle along with the neuromuscular reprogramming. So again, with a muscle energy technique, we want to get an isometric contraction of the target muscle, hold it for about 10 seconds, and then release it. That will give a physical stretch to the muscle, along with the neuromuscular reprogramming to teach the muscle to relax. Muscle energy techniques can be done on any muscle in the body. Today we're just showing the Quadratus Lumborum. So, Alicia, I'm going to push on your hip and don't let me move you. Hold it for 10 seconds and relax. And we get the stretch out of the QL. An easy way to access stretching the QL because it's blocked by other muscles.